1. James's story begins. James Jordan, born in 1950, is a retired hair designer who has always lived an active sports-filled life. But years of standing long hours at work, combined with old sports injuries, eventually caught up with him, leaving him with chronic low back pain and sciatica down his right leg. When James first came for treatment, he doubted anything could truly help. Yet after just 5 weeks of intensive acupuncture and Tui-na therapy, the pain eased, and he regained the ability to enjoy daily life again. Today, with regular maintenance acupuncture, James feels better than ever. His retirement is brighter, his days are more enjoyable, and his quality of life has been fully restored. 2. Meet James.
Could you please introduce yourself?
Hi, I'm James Jordan. I'm 75 years old. I'm a retired hairdresser. Worked for 42 years.
What initially brought you here for treatment?
Sciatica and sports injuries. I was very active, extreme skier, and mountain biker, and kickboxer, and a lot of injuries, and wear and tear from sports injuries.
Which specific area or condition did you seek treatment for? And why did you feel acupuncture might help?
Sciatica and knee pain.
At your first visit, how severe was your pain? And how would you describe your condition now?
Oh, my pain on a scale of 1 to 10 was probably an 8. And now it's seldom and intermittent at best, and maybe a 2.
That's wonderful progress. What motivates you to continue with weekly appointments?
For maintenance. I've done this for years off and on when we lived in Orange, and it's down to allow me to do whatever I want to do now.
How has your overall experience been with KimAcupuncture?
Service has been great. I like it. It's easy, and it's good. It works.
What would you say to others who may be suffering from the same condition you once had?
Yes, if you are having problems, I would give acupuncture a shot, because it's much better than taking pills, and I think it works.
Do you see yourself continuing with regular maintenance treatments?
Yes, I do. I plan to come regularly, and I have been coming regularly. So, and it allows me to do what I want to do. So.
Finally, is there anything you would like to share with people who may not know much about acupuncture?
I would say if you've tried everything else and given everything and nothing works, acupuncture give that a try too, because I think it works, and I've recommended other people before try acupuncture that were having pain and difficulties.
Thank you so much for sharing your story and time with us.
You're welcome. Thanks.
3. Diagnosis: degenerative disc and sciatica. James was diagnosed with degenerative disc disease, one of the most common causes of lumbago, or lower back pain. As the discs between the vertebrae wear down with age, they lose their cushioning effect leading to stiffness, chronic pain, and reduced mobility. In many cases, this condition is accompanied by sciatica, where pain radiates down the leg due to pressure on the sciatic nerve. This combination of back pain and radiating leg pain is something many patients struggle with in daily life. In James's case, his knee joints were also worn down to bone and bone, and part of his knee pain was caused by sciatica as well. Rather than choosing surgery, he decided to manage his condition with acupuncture. If you'd like to learn more about degenerative disc disease and sciatica, please be sure to watch the full video linked below.